You feel tired all the time. You've gained weight, your skin is dry, your thoughts are sluggish. And no matter how much you sleep, you never feel rested. What if all of this wasn't just aging or stress, but something deeper, something hormonal? Hypothyroidism is common but often missed. It develops slowly, mimicking everyday fatigue and mood swings, while quietly disrupting your metabolism, energy, and even your heart. In this video, we'll uncover what really happens when your thyroid slows down, why it matters, how to spot the signs early, and what you can do to take back control of your body and mind. Hypothyroidism is a condition characterized by the reduced function of the thyroid gland, primarily due to inadequate hormone production. While it often manifests around the age of 60, it can develop earlier in life and is about 3 times more prevalent in women. The most common cause of decreased thyroid function is autoimmune hypothyroidism, also known as Hashimoto's disease. In this case, the immune system treats the thyroid gland like a threat, just like a virus or bacteria, and starts an attack. Over time, this attack damages the thyroid and causes it to make fewer hormones. It usually develops slowly over months or years. Other, less common causes of hypothyroidism include thyroid inflammation, thyroid surgery, certain medications, radiation therapy to the neck, tumors, or injuries to the pituitary gland, which is located beneath the brain and regulates various glands, including the thyroid. Historically, a lack of iodine in the diet was a significant cause of impaired thyroid function, since iodine is essential for thyroid hormone production. However, due to iodization of foods, particularly salt, iodine deficiency is now rarely a cause of this disorder. Some dietary supplements, such as soybeans, cassava, cabbage, kale, and broccoli, can interfere with iodine absorption and exacerbate deficiency. Initially, individuals with hypothyroidism may experience increased fatigue, heightened sensitivity to cold, difficulty concentrating, memory issues, and weight gain despite a decreased appetite. Other signs include thinning hair that breaks easily, potential hair loss, including eyebrows known as alopecia. Muscle dysfunction, stiffness, and pain is common. The skin may become dry and thin, and hands and feet might feel cold to the touch. Additionally, irregular bowel movements and constipation are common. Depending on the underlying cause, the thyroid gland may appear enlarged and could be either painful or painless when touched. An enlarged thyroid gland is called a goiter. A large goiter may cause problems with swallowing or breathing. Heart rate may slow down, and the risk of heart disease and heart failure is increased. That's mainly because people with an underreactive thyroid tend to develop high levels of bad cholesterol. Women may experience irregularities in their menstrual cycles, such as less frequent periods and heavier bleeding. Both men and women may notice a decrease in sexual drive. Low levels of thyroid hormone can interfere with ovulation, which can limit fertility. Babies born to the people with untreated thyroid disease may have a higher risk of birth defects compared with babies born to mothers who do not have thyroid disease. Infants with hypothyroidism present at birth that go untreated are at risk of serious physical and mental development problems. However, if the condition is diagnosed within the first few months of life, the chances of normal development are excellent. Carpal tunnel syndrome, which involves the swelling of tendons in the wrist that compress nerves, can lead to numbness and weakness in the hands. If left untreated, hypothyroidism can damage nerves that carry information from the brain and spinal cord to the rest of the body, causing pain, numbness, and tingling in the arms and legs. If left untreated, symptoms can progress to swelling of the hands, feet, and face, leading to characteristic appearance known as myxedema. This condition may also cause hoarseness and hearing loss, and in severe cases, it can lead to a life-threatening condition called myxedema coma that can be triggered by sedatives, infection, or other stress to the body. Its symptoms include intense cold intolerance and drowsiness, followed by an extreme lack of energy and then unconsciousness. Diagnosis of hypothyroidism is typically straightforward once it is suspected. A doctor, typically an endocrinologist, will conduct a physical examination, palpate the thyroid gland, and perform laboratory tests to evaluate thyroid hormone levels. The physician will also ask about current symptoms, related medical conditions, and medications being taken. Patients should provide information about their medications, as some can interfere with thyroid function. It is advisable to record medication names and dosages or to bring the medicine containers to the appointment. If thyroid hormone levels are found to be low, further tests will determine the cause. This usually involves checking for specific antibodies against parts of the thyroid and conducting an ultrasound of the thyroid gland. Additionally, thyroid stimulating hormone, or TSH, levels are measured. This hormone regulates thyroid function and is typically elevated when thyroid hormones are lacking. Treatment generally requires lifelong management. Currently, medications containing thyroid hormones are available. After starting therapy, the doctor will typically monitor laboratory tests for 2 to 3 months, adjusting the dosage until hormone levels normalize. Following this adjustment period, routine checkups can occur every 6 months to a year. Most symptoms resolve within 4 to 6 months after laboratory findings normalize. If a patient inconsistently follows the treatment regimen or only takes medication before checkups, this will be reflected in the test results. The prognosis for treatment is excellent. With appropriate therapy and regular monitoring, individuals affected by hypothyroidism can lead normal lives. Hypothyroidism may start with subtle symptoms, but its impact can ripple through nearly every system in the body. Recognizing the signs early and seeking timely medical evaluation are crucial steps toward effective management. Fortunately, with accurate diagnosis, consistent treatment, and regular monitoring, most people with hypothyroidism can regain their energy, stabilize their weight, and restore their overall well-being. If you or someone you know experiences unexplained fatigue, weight changes, or other symptoms mentioned in this video, it might be more than just stress. Your thyroid could be trying to tell you something. Thanks for watching. If you found this video helpful, consider subscribing for more educational content. Have a great day.